everybody. Thanks for inviting me to your business. I appreciate it. I like doing corporate talks. I like doing corporate wellness programs. It benefits me because what I'm doing is I'm helping you be more productive at your workstation. And also, if you're more productive at your workstation, what's going to do is going to increase your profits, and it's also going to make your work a little bit funner to come to. So, thank you for inviting me. I appreciate it. What I'm talking today is a guide to a pain-free back. Okay, so who am I? My name is Dr. Jawad. I graduated from National University of Health Sciences in 2003. I was an associate until 2004 through 2006. When I moved to Carroll Stream, I opened up my own private practice in Carroll Stream, Illinois. I always say I'm kind of smart. I know a few things. I have a couple fellowships and a Diplomat. People ask, what's a Diplomat? And again, the best response is, in your field, a Diplomat means that you achieve the highest educational level in your field. So that's what a Diplomat is. And also, too, I'm an adjunct professor over at the College of DuPage. I teach all the youngins, the up-and-coming healthcare professionals, a few things about the human anatomy and physiology. So let's begin. So the question is always, why do I hurt? Why do I hurt? Now, back pain is real, okay? Lower back pain, it's an epidemic in America. It affects 8 out of every 10 people at one time or another. We spend in the roundabouts of $50 billion, okay, on diagnosis, treatment, and disability payment for low back pain. Over 300,000 surgeries are performed, and over half will suffer from low back pain again in their future. One thing I always tell my patients who have low back surgery, and they get what's called a fusion. Now, fusion is like a metal gauge, a metal gadget where they put in their spine, which basically it helps the spine from collapsing on itself, okay? That doesn't mean that they're going to be pain-free. It just means that they're going to basically live to 100, but they're going to be in pain. It literally affects every aspect of your life. It affects every aspect of your life. How many of you have had low back pain and you just could not do what you wanted to do because of your low back pain? Is that a common thread? Yes, it is. It takes away from quality time for you and your family, most importantly. So most back disorders are the result of, again, low back pain. It's a plethora of reasons why we hurt. Stressful living at work or work habits. Computer work, long commutes. I have a patient of mine who literally drives an hour and a half every day to work. That's 3 hours in the car, and he wonders why his back is hurting. Poor biomechanics, like incorrect lifting, loss of flexibility, decline of overall fitness, poor posture. A lot of people are overweight. I'm not pointing any fingers, but I see a few. And also pregnancy disorders. Yes, it will throw your back off. So why is it an epidemic? It's an epidemic because too much time and money is spent on treating low back pain. Again, the key word here is treating low back pain rather than preventing it from happening. We would rather treat something than prevent it from happening, which, by the way, prevention is a fraction of the cost. Only 3 cents of every dollar spent on the care of low back pain is spent on treatment. Okay, so why is it an epidemic? Too much time and money is spent on treating the low back. Oh, I'm sorry, I just wrote that, sorry. Okay. Are the doctors at fault? No, it's not the doctor's fault. We are doing the best we can to help people with low back pain. The problem is, we rarely do anything to help ourselves until the pain occurs, and oftentimes it's too late. One of the questions I always ask my patients is, how long have you been having this pain for? And the typical answer is, I don't know, doc. It's been about a couple months. And I always respond to, then why'd you wait? It's a good thing you waited that long to see me. So and again, I'm guilty of it myself. I am guilty of it myself. So I'm not secluding myself from the bunch, I'm guilty as well. We have stressful work days, lack of physical fitness, too much time sitting at work and in cars. We're slouched at the computers. We're slouched watching the TV. We have poor posture and, most important, improper body mechanics. So before just again, a little, what I'm going to do is just give you a little anatomy lesson. So basically, why do you hurt? So the anatomy lessons, the backbone is 24 bones stacked up like a bunch of Legos. We have 7 neck bones, we have 12 big back bones, and we have 5 low back bones. 7, 12, 5. I always say the best way to describe it the way I learned it, you eat breakfast at 7 o'clock, you eat lunch at noon, and you have dinner at 5 o'clock. So the purpose of the spine, okay, the purpose of your backbone is to protect the spinal cord as it travels inside the spine. Your backbone is to protect the spine, the spinal column, which in a computer sense, that's the relay between the main drive and the rest of the system, is your spinal cord. It's attachment site for your arms and legs, okay, and gives our body its erect posture and moves with us during all of our motions and activities of our body. Now, don't forget, a little history lesson. We all started off as quadrupeds. We all started off on all fours. Okay, so so your backbone was like in a lateral position. What happened as we evolved? We stood upright. You never hear of your dog and cat or animals having low back pain, right? We have low back pain because now we're standing erect, and what happens? We have compressive forces called gravity. So we are constantly fighting gravitational forces daily, and this is why we have low back pain, one of the causes. Okay, so the vertebral unit. Okay, just to get into a little bit more of the scientific part of our backbone. Okay, the individual bones, 24 bones stacked up like a bunch of Legos. Each individual bone is called the vertebrae. And we have 3 important parts of the vertebrae. In the back of the vertebrae is called the facets. And then what the facets are important for, and they're important for gliding. Okay, also too, they're important for when we bend over backwards, we're not going to flop over backwards. That's why when we extend, we actually stop. They direct the vertebrae during motion. They guide the vertebrae like a rubber on a like the rudder on the ship. Also too, we have little tiny holes on each side of the vertebrae called the foramen. Now those holes, that's what all the nerves, that's what the blood vessels, the immune system called the lymphatic system course through to get to the spinal cord, okay? Nerves exit and travel throughout the spine, and the bulky part of the vertebrae, that's called the body. So there's 3 most important parts: the facets, which is the back of the vertebrae, the foramen, which align each side when you look at it, when you look at a bone, and also the body in of itself. That's a hard component. So if you know, like the big bone, like the lumbar area, the big thicker part, that's the body of the vertebrae, okay? And that is very important because that's what bears weight of our spine. So a lot of people hear about this big thick nerve called the sciatic nerve. Okay, we always hear of sciatica. Some people have it, yes, I can see right there, yes, you have it yourself. Okay. Yeah, what is the sciatic nerve? The sciatic nerve is the largest nerve of the body. It starts at our lower spine and it travels all the way down to your foot. We have 2 of them. Okay, we have 2 sciatic nerves. I had a patient of mine come in the other day, and he was telling me his sciatic nerve pain was hurting. I said, which one? He said, my sciatic nerve. I said, which one? He says, oh, we have 2? A left and a right. Yes, which one? Left. He was surprised that he has 2. I always say, which one? The disc. You hear about discs. Okay, 24 bones stacked up like a bunch of Legos. In between, we have a nice cushiony disc. The best way to describe a disc is a donut filled with jelly. Not a jelly donut, but a donut filled with jelly. And that acts as a cushion. And that's the most important structure of the vertebrae, because it's firmly attached to the vertebrae above and below and holds the 2 vertebrae together. There's 2 functions. They separate the 2 vertebrae, and the space that it creates contributes to the size. It contributes to the size of the foramen. Remember those 2 holes in the side of the bones that all the nerves and arteries, those course through? They make sure that foramen, that hole, is big enough. Okay? Also too, the disc acts as a shock absorber. So every time you're walking and so forth and so on, that disc helps bounce the spine. Okay, however, when it degenerates, remember the disc is a donut filled with jelly. So what happens to that jelly inside the donut? It degenerates. What happens when it degenerates? It shrinks. This is also too why we shrink as we get older. I have 80 and 90-year-old patients who I ask, how tall are they? And they say, well, I used to be 5'4", but now I'm 5'2". Wow, you shrink. I shrunk. Why? Because the donut inside the jelly, the jelly inside the donut dries up. It degenerates. So when the framing gets small, it does not allow enough room for the nerves to pass. So what happens? Compression. This is why you're in pain, because when the disc inside, when the jelly inside the donut dries up, the foramen, the hole that the nerve goes through, starts to shrink. Now again, there's different varieties of pain, of the nerve pain, and you may have experienced it yourself. Sometimes, again, you'll have pain all the way down your arm, or else pain all the way down your leg. So there's two distinct parts, the jelly, okay, the jelly and the donut. The jelly is inside, the most inside part, that's called the nucleus. Okay, if you guys remember from high school biology, anything inside the cell, the core inside the shell is the nucleus, so that's the nucleus. And that helps absorb the shocks that our spine takes when we walk, sit, bend, and run, so forth and so on. And we have the outside, the donut in and of itself, those are made with rings, okay? Those are concentric rings that spread out, they're elastic rings that spread out through the disc. So it stretches when we move, and it acts like the metal rings around a wine barrel holding the nucleus inside of the disc. So again, those big barrels, imagine the rings, that's what holds the barrel together, okay? And that stretches. Okay, so you can see here, again, you have the nucleus on the inside, and you have the annulus on the outside. Again, this is the jelly filled with donut. You can see here, this is the jelly, this is the donut filled with jelly. Okay, so the other supporting structures of your backbone. Okay, we have the muscles, we have ligaments. Now muscles hold bone to bone, okay? And they help support the back. And the first structures are called, again, those are the first structures that are called upon to help the spine move. And that's the first line of defense. And then we have the ligaments, which help attach the vertebrae to each other. Okay, so the muscles allow the motions. The ligaments is what holds which holds the muscles to the bone. And it can be stretched and torn, which alone can result in back pain. So you have a lot of forces involved, which will give you your back pain. So again, is it muscle, is it ligament, is it nerve, is it this, is it that? It's everything, okay? Because those are the main components of the spine, which will give you back pain. And you can see a very, very complex picture, again, very complex picture of what the spine is. Okay, so we have different types of chronic low back pain, okay? Of low back pain. So keep one thing in mind, pain, I always say pain is just a warning sign that something is wrong. And some people have no pain, and that's fine. But also too, pain is an indicator that something's wrong, okay? It serves its purpose. We have what's called chronic pain. Chronic muscle strains and ligament sprains. Muscles and ligaments are very, very vulnerable to injury, okay? When they're overused and stressed beyond their normal range of motion. How many of you, okay, here's a question. How many of you have carried something too heavy, and when you placed it down, instead of bending at the knees, you kind of like threw it, okay? You kind of threw the box on the floor, or threw the box on the table. That's overstretching the muscles and ligaments that have a purpose, and this is where injuries occur, okay? So when muscles are worn out condition, they leave the joints vulnerable for excessive stress. Also, this is why as we get older, and we have deconditioned muscles, this is why we're more open for injury. So we have arthritis. Now, first and foremost, arthritis is a nasty word, okay? It's very nasty because a lot of the medical professionals overuse the word arthritis. You have arthritis, that's why you hurt, Miss Jones. Yeah, it is. However, what is arthritis? I could pull any one of my, I teach 18 to 45-year-olds. I could pull any 18-year-old out of my class, take them to my office, x-ray them, and show them that they have arthritis in their spine, okay? Arthritis is just a nasty word for just wear and tear. It's like rust, okay? Anybody over the age of 20 who has had a life has some type of arthritis. The question is, how is arthritis going to affect your pain, okay? And that's another lecture altogether. Also too, muscle spasms. When the muscles become tired or stretched beyond its limit, it reacts with spasm and cramping. Okay, so those are different types of pain. Remember when I was talking about the backbone, the facet joints, the joints in the back of the spine which help guide the spine, okay? Those also too, those are very, very common. And they're they're most easily correctable of all back disorders. They're not intended to bear weight. Those are not weight-bearing joints. Remember, those are just gliding, like the rudder of the ship. All that's doing is guiding the ship to its direction. That's in the back of the spine, that's what it's doing. It's guiding your spine into a motion. It occurs after activities that require twisting. So if you're in a twisting exercise or a twisting mechanism and you get back pain, okay, that's your facets. Those are the joints in the back that are getting damaged or dysfunctional. Occurs when the curve of the lower back becomes excessive, mainly due to weak abdominal muscles, weight gain, pregnancy, or pot-bellied men. You see these men who have, we always call them Milwaukee tumor. Yes, you know, you're nodding your head. Yes, what happens, their bodies become too much stressed out forward. So again, what that's doing to those weight-bearing joints, the gliding joints, again, they're compressing them. That's why typically men who have big bellies have low back pain. Pregnant women, again, with their bellies. Again, when you're pregnant, what do you have? You have a 30-pound bowling ball in your uterus, and what you want to do, you want to fall forward. But what do you do instead? You jog your head back. And that's where a lot of times with pregnancy, low back pain occurs in pregnancy. And that is due to the facet joints. Okay, another type of low back pain you're going to get disc injuries. Remember, the disc is a donut filled with jelly, very, very vulnerable to injury because when the jelly inside the donut starts to dry up, it compresses the bones, it pinches the nerve. So again, it degenerates over time. Okay, so the inner rings of the annulus, what happens, those nice rings, they rip and tear. And the jelly of the nucleus, what happens, it migrates, starts to make its way out. Okay? So what happens, again, it starts to make its way out gradually. Unless you picked up something very, very heavy, not protecting yourself, and bam, you blow a disc out. And that can happen. That can happen. Because what happens, the nucleus, the material inside, moves into the tears of the annulus and the height of the disc decreases and it loses its shock absorbing power. Again, one of the functions of the disc is the shock absorber. Again, there's different types. There's moderate, there's severe. And again, it all depends on one thing. How much is that jelly inside the donut moving outside? Okay? It's kind of like squeeze, it's like pushing against the wall. Is it pushing a little bit, or is it pushing so far that it's breaking all these rings and starting to come down your spinal cord? And that's a different situation altogether. So what happens again, and that's called the disc bulge or protrusion. Is it bulging or is it protruding out? Is it protruding out? So you have a disc bulge. Some people have heard it. So what's the difference between a disc bulge and a disc herniation? A disc bulge is only just when it pushes against, again, the jelly inside the disc is pushing against the wall. Okay? That's a disc bulge. And by the way, everybody has a disc bulge. I have 3 in my neck, 3 in my spine. Anybody over the age of 20 will have a disc bulge. Again, it's just on a wear and tear. That's all. But this is when this is when the rubber hits the road. And this is called this is a herniation. So what happens when a herniation occurs? It's most severe when the nucleus of the disc ruptures through the annulus completely. And there's different grades. Okay, there's different grades. There's a prolapse, extrusion, it tore through, and oh boy, sequestrian. It tore through, and now it's digging down your spine. And this is when, if you hear about people, okay, you had one? Okay, yes. What happened? You had pain all the way down your leg, all the way down to the outer foot or the inner? The outer, okay, the outer, yes, okay. So what happened? You went to the doctor and they had surgery? Okay. Do you have a cage in your lower back? No? Okay. Okay, so the gentleman in the back, what happened? Okay. Very simple. What they do is that when the jelly inside the donut comes out and creeps down the spine, you get a lot of pain because what's there? The sciatic nerve. And so what they do is a very simple surgery. They just go in there and they just kind of nip it, they cut it off, they throw it away, and they bondo it closed. very simple. In this gentleman's case, that's all they did. So again, they saved your disc. Yeah, okay, cool. All right, yes. So sciatic. People always talk about sciatic. Oh, my sciatic nerve hurts. Well, what is that? The sciatic nerve is the longest nerve of the body. Very, very common. It starts at the lower back, and it sends motor impulses and returns sensory impulses from the legs. Again, the reason why you're able to move your pinky toe and or feel stuff on your pinky toe is because the sciatic nerve is communicating with the brain what's going on in that region. Sometimes you get inflammation of the sciatic nerve. And again, the common symptom is radiation to one or both legs. Again, we have two. We have two sciatic nerves. The most common presentation that I see in my office, pain down into the buttock and down to the back of the leg. The wonderful thing about the nerves of the body, the distribution of pain tells me exactly where it's at. The sciatic nerve, it starts in the lower spine, it goes all the way down to the inner and outer foot. So, if you have pain, it'll show the course of distribution. So that's the sciatic nerve. So again, some types of lower back pain. You have muscle spasms. Again, what happens with the muscle spasm? Again, this is cyclic. We have this. You have a muscle spasm, creates a decreased circulation. Your muscles are literally getting choked. They're getting choked. So not enough blood supply could go to that area to help relax the muscles. Then you get further pain, you get stiffness. Again, you got people walking. I got people walking all the time. Here's something. Do this. Go to Jewel, go to your local grocery store, and just people watch. Watch the people not pushing their carts, but leaning on their carts to push it. Chronic low back pain because they can't stand up straight. They can't stand up straight because the pain, muscle stiffness, decreased circulation, spasm. They compensate. This is what we see. Or disc injuries, which go hand in hand. So again, arthritis, you may learn some arthritis in the spine, but again, arthritis is very, very natural. However, there is a course of severe arthritis that can occur throughout your lifetime. Or facet syndrome, again, these are the nice joints in the back of your body, again, which helps glide the spine. So, which again, that could also cause pain as well. Okay, so forward bending. What happens when we're in pain? Forward bending, where our flex forward, our lumbar spine becomes rounded, it puts strain on the disc. It's like squeezing a jelly donut and just squeezing it from the front. What's happening with the jelly? It's going backwards. Muscles are stretched and the ligaments are put under constant pressure to maintain the structures of our lower back. Bending forward, forward posture puts a lot of strain on your lower spine. Sitting places more stress on our lower back than standing and or reclining. Back with our great creator, whoever you may believe, when he created us, he had no intentions of us sitting for 9 hours during our day. We were made, man, M-A-N, or woman, we were made to move. We were made to sit. But now in the 21st century, what do you spend most of your time doing? Sitting. Puts a lot of strain in your lower back. What happens is the disc is forced back against the walls of the rings, which will cause rips and tears over time. So, again, the pressure on your disc. So lying down, 25% pressure on your disc. Standing in a straight position, 100%, again, 100% pounds of pressure on your disc. Bending at the waist with a little forward in a standing position. Now you're doubling it, 220. What happens when you're sitting down in a forward position? You're increasing the pressure on your disc 275%. That's a lot of pressure. When picking up an object while sitting in a chair. Object, any object. A pencil, a book, your computer, your purse. How many times after a long car ride you get out of the car and you're in pain? What do you do after a long car ride? You open the door and you get up gradually. Okay? Why? Because all that pressure was put on your disc when you're sitting. Other causes of low back pain. Some people have accidents. Okay, performing the same activity day in, day out without changing your posture can contribute to work-related injuries by overusing the same muscles. Sitting at your desk day in and day out, I know most of you get stuck in projects and you're sitting for hours. For hours. The body wasn't meant to sit for this long. Poor physical condition. Now let's talk about poor physical condition. Poorly conditioned muscles force ligaments, including the disc of our lower back, to work harder, which makes them vulnerable. Again, now you're saying now you're in poor physical condition. Okay. Now let's top all off, lack of flexibility. Okay, now I know when we get older, we all lose our flexibility, but when you're sitting in one posture for a long time, what do? What happens on a long car ride? You get out of the car, and you get up, and you kind of gradually move. Okay, we're all guilty of this. We lose our flexibility. Puts a lot of pressure on your lower back and your disc. If you don't use it, you lose it. Okay, you lose it if you don't keep yourself flexible. You'll lose it. Again, here, and it's a vicious cycle. It's a vicious cycle. Vicious cycle. So you lose the flexibility, creates joint immobility, which means lack of joint movement. If you don't have joint movement, it puts excessive strain on the muscles and ligaments, where you get sprains and strains. And again, the pain gradually. The better news is if the pain actually happened instantaneously. But like what happens like with a leaky pipe, with the pipe bursting, it had to leak first. So muscle weakness, you have joint instability, which causes ligament sprains, causes stiffness, decreased motion. By the way, ligament sprains could also be muscle strains because they work hand in hand. So correct body mechanics, what can be done? Correct body mechanics can be prevented by learning how to use your back properly during the day, the way you sit, stand, lift, bend, and sleep all contribute to how your back feels. Consideration, most of us are forced to sit a considerable amount during the daytime. I know that you guys get wrapped up in projects. I know. I talked to your boss. I talked to a few guys before, a few of you before I came in here. I know you get wrapped up in projects for hours, for sitting for hours. I can't sit longer than 5 minutes. I have ADD. Hey, look, a squirrel. Hours. What do you do? How do you work that? Keep a water jug near your workstation. Drink it. Every 45 minutes, you're going to get up and what? You're going to have to pee. That's your excuse of getting up and moving around. That will help body posture, which will help body mechanics. Take a bathroom break and stretch to increase blood flow throughout the body. Stretch. Go into the bathroom, stretch. Stretch. We don't stretch anymore. We don't stretch anymore. So that will help. Sitting. So how do you sit? Sitting. Adjust elbows to be at 90 degrees. The hip and knees should be at 90 degrees. The lower back firmly against the back of a chair. Use a lumbar support to support the lumbar spine. The correct sitting posture for a computer, right here. Now I know, to add on to that, what I always recommend with my patients is that if you're sitting for a longer period of time, what you can do, lower the chair an inch for an hour, and then raise the chair 2 inches for the next hour, because again, you're going to lose an inch and you want to gain an inch, and then go back to normal. What that does, that decreases the lever arm pressure on your body. Try it, it works. It works. Again, I'm a professor. When I'm doing lectures on the weekends, I have to sit at my desk for a long time. Every hour, not only do I have water, but I switch the position of my chair. It helps with the lever arms to change the posture. It changes the stress that you put on your muscles and ligaments. The muscles, if they're overworked or underused, will cause pain. Okay. Next thing, sleeping. Sleeping. Never, 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 never sleep on your stomach. I tell my patients this, I don't care how you sleep, just as long as it's never on your stomach. Why? How else am I supposed to sleep? Because it twists the spine and it puts that pressure on the lungs to breathe. You have to breathe. And especially for females who have breast tissue. And by the way, for females, the bigger the breast tissue, the more pressure is put on the spine to breathe. So that's another reason why to get off your stomach. You should be on the side or on your back. If you're on your side, knees bent, place a pillow in between the knees. What does the hip girdle keeps everything at neutral level. On your back, put a pillow or something like that, or like a throw pillow underneath your knees. Again, what that's going to do is kind of flatten out your back and takes pressure off the lower back and the pelvic girdle as well. Okay, again. Very bad. Good and good. Actually, this is better. So yeah, just so keep that in mind. Standing, keep your stomach tight. Shift weight from one leg to the other to keep the blood moving throughout the body. Kind of like these kind of like the guards, okay? Like guards. For the Queen of England, the guards that stand outside the castle, they're in a very erect posture. What they have to do, because keep one thing in mind, blood flows in a circular pattern. What the guards do, how they're trained, for one, to keep them awake, but also two, to prevent having aches and pains in their leg areas. Therefore, what they recommend, go on their tippy toes. When they go on their tippy toes, the muscles in of itself pushes blood back up. They keep their stomach tight, keep your stomach tight. That helps support the lower back. This is your core, okay? If you have a weak core, you're gonna have low back pain. So correct rules of lifting. So before you lift anything, again, anything from a clicker to a chair or a box or anything, first, have a good idea how heavy it is to prepare yourself to lift it, okay? An object that weighs 10 pounds held with your arms outstretched can place over 100 pounds of force on your lower back. 10 pounds, 100 pounds. 20 pounds, 200 pounds. 30 pounds, 300 pounds. 5 pounds, 50 pounds. So make sure that you know what you're going to pick up. Straddle the object with your feet. Keep the object close to the body. What it does, it reduces strain in your lower back. Lift with your legs, keeping your stomach tight, knees bent, and head up. Again, if you ever see a powerlifter squat, pick up anything, they support themselves. The reason why powerlifters can lift so much weight and they're not blowing out their back is they prepare their body for the lift. They get underneath and they keep that object close to them. They keep it close to them. They keep it close to their core. They have to. If they don't, they lift 100, 200, 400 pounds out there, they can blow their back out. And by the way, when do you have mostly low back pain? Is when you're bending over, picking up a pencil. Not when you're preparing your body for moving furniture. Keep it close. Bend at the knees, bend at the waist. Okay. Face objects you are planning to carry to avoid twisting to prevent injury. You want to hold it real close to your body. Real close to your body. You like it. Imagine you like it. Okay? Health and exercise. Exercise is the key to good health. I know in this crazy world, 21st century, we have to find time to exercise. It wasn't so easy. I even heard, in some school districts, they're trying to take away recess from our kids. Like that helps. Find something you enjoy and do it often. People ask me, well, what exercise is best? I just say whatever you enjoy and do it often. If you like walking, join a walking club. If you like running, run. If you like golfing, golf. I like to work out. So that's my thing, okay? But you want to concentrate on spinal exercises. Concentrate on the supporting muscles, the back muscles, the buttocks, the legs, and the abdomen. This is your core. When you exercise, you want to focus on the core. Core is a big thing. Core is the #1 reason why you have back pain, especially as you get older. I have 45 to 50-year-olds coming in with low back pain, no idea why. I poke their stomach. That's why. And I make that noise. Yeah, I make that noise. That's why you have low back pain. Shut up. They do. They do. Okay? It lessens the chance of avoiding low back pain because of the prime movers in our back, and it's the first line of protection against injury. Core, a good core. Okay, 3 important also do stretching. Stretching. 3 important types: stretching, three health and exercise, 3 important types, stretching, strengthening, and aerobic. Stretching, stretch at least twice a day, If you can do it more times, that bless you, that's great. Stretch at least twice a day, morning and evening. Preferably, I always recommend in the shower. In the shower, you have the warm water loosen up the muscles. You have conditioner in your hair. You have to wait anyways for that conditioner to work. Might as well make it useful. Stretch, okay? It loosens the joint and increases the range of motion. It helps relax the body, and then at bedtime, before bed, it helps relax the body before bedtime. It prepares them for a rest while they're done in the evening. You want to hold it for, again, idealistically, you want to hold it in between 20 to 30 seconds, but at least 10. No more than 30, no less than 10. What happens if you do it before longer than 30? It's kind of like this. You take a spring. You stretch the spring out. What happens if the spring goes too much? It elongates, okay? Same with muscles. If you hold it for too long, it's almost counterproductive, okay? So no less than 10, no more than 30. Exercise, strengthening exercises. Whether it be free weights, machines, Pilates, it has to be some type of resistant exercise. It has to be. Yoga's phenomenal to loosen up the joints. However, you need the other principle, you need to build up the muscle strength, okay? Because it's the muscles that support the back and the ligaments, the joints, which have pain receptors in there. I love yoga. I do yoga, okay, when I have time. I have a lot of my yoga patients who say, yeah, I do yoga, but they're always in pain. Yeah, they could bend over backwards and they could twist their head around and they could actually, they could look at their behind just by spin their head. Cool trick. But they're not strengthening up the ligaments. They're not strengthening the joints. They have the flexibility, but no strength. Now again, I have other people, bodybuilders and really like linemen, who are very, very strong, no flexibility. Still hurt. So it's important. Exercise, you want to do a minimal of 3 to 4 times a week. If you don't get, with muscles, if you don't use it, you lose it. It's called muscle atrophy. And again, we're not getting any younger. We're not getting any younger. It should only take about 30 to 45 minutes max. What happens is that anything longer than 45 minutes, especially strength training, it creates muscle wasting. We only have about 45 minutes of fuel in our body for exercise. And I'm talking about like strength training, okay? Again, it doesn't matter if you're doing it with weights or machines, as long as you're pushing a force beyond your comfort. Resistance, again, how do you learn something? You learn something by challenging your brain. How do you grow bigger muscles? You challenge your muscle strength. If you're taking this gadget here and lifting it 1,000 times, you're not doing anything, okay? But you pick up this table 10 times, you're going to grow muscles. And then eventually you have to get a bigger table. So you want to do some type of strength training exercise. But also too, you only have about 45 minutes of fuel. That's it. So the people always ask me, so do I do cardio first or do I do strength training first? I always say it's kind of like this. Think about it this way. If I'm only going to have 45 minutes of energy, that's it. Are you and I'm going to pick on her. Are you and I going to first run 10 miles? And then try to move the boulders from one area of the room to the other? No. No, why? Because we only have 45 minutes of energy. We want to maximize what we got. So flip it over. We want to use that energy and move the boulders from one side to the other, and then with the time remaining, we can do our cardio, because cardio actually takes less energy than trying to build muscle. Does that make sense? Does that make sense? Okay. Now, aerobic activity. Okay, this is also important. Aerobic activity is phenomenal for the heart and the cardiovascular system. It helps with the blood vessels and the venous system. So what do you want to do? Walk, swim, run, cycle. Again, whatever suits your fancy. Okay, if you can't run, walk. I'm not a big runner, I like to walk. Me and my girl, we walk all the time. We walk my little doggy all the time. We take a lot of walks. And actually, she has one of those Fitbits, or whatever those, you know, the monitors. And sometimes we'll walk and she'll come to me and say, we walked 15 miles today. 15 miles in a day. So yeah, it works, it helps. It's the easiest, safest, and least expensive aerobic activity. Do it about 3 to 5 times a week. Minimum 12 to 15 minutes, max about 45, but again, if you want to go longer, that's fine. Start at 15 minutes and increase by 5 minutes each day. Now again, if you're going to do like cycling or running or like doing cardiovascular work, this is what I always recommend. Because cardiovascular work, you build a tolerance to it very, very fast. So I always recommend start off at 15 minutes, like Monday, do 20 minutes Tuesday, 25 minutes Wednesday, 30 minutes Thursday, 35 minutes Friday. Again, if you want to start, then if you want to maximize at 40, that's fine. But then start on Monday, go back to 15 minutes. Okay? Now again, I'm talking about as like aerobic exercise, not as like running. Okay? If you want to be a runner, run, that's fine. But again, with aerobic activity, start off at 15, 20, 25, 30, 40, and if you feel like you want to do 45. Reason being, because then you're never going to get bored. The common thing is that most people think is that, okay, if I do 45 minutes today, I got to do 50 tomorrow, and then 60 the next day, and then to achieve the benefits, I got to do 90 minutes, and you know what, forget about it. I'm done. I'm done. For those of us who grew up in the 80s and 90s, walking past the aerobics room, and also to watch marathons. If running was such a good fat loss tool, anybody who run these marathons, or the aerobics, would be paper thin. It would be the key for weight loss. No. It helps with the cardiovascular system. It'll make you lose weight if you haven't done it. But no, that's not key for weight loss. Strength training is. Okay? So in conclusion, so sum all up, lower back pain can be avoided in most cases by taking time to educate yourself on the correct way to use your back throughout the day. Control posture. Posture is a big thing. Lifting correctly and performing daily activities in a safe fashion. Commit yourself to getting in better spinal shape to avoid breakdown. And don't be fooled by lack of pain. Once you have it, the potential, it will return. We're getting older. We're getting older. All right. So in conclusion, commitment is doing what you said you were going to do long after you said you were going to do it. Stay committed. Make a plan. I always say, you know what, why not now? There is no good time, there is no better time than the present. Today is always tomorrow's yesterday, and tomorrow never comes. So if you want to, start today. Why not? Prevention is the key to good health. So thank you very much for your time. I appreciate it. Again, my name is Dr. Jawad. My practice is in Carroll Stream, Illinois. My website is www.totalhealthdupage.com. My phone number is 630-653-2225. I'm on Facebook, and also too, I'm on YouTube. I'm doing a lot of videos on YouTube. As you can see, I'm recording this one. Again, for your viewing pleasure, and also to if you want to see other videos. So I appreciate it very much.